How do you handle difficult coworkers?
Handling difficult coworkers requires a combination of empathy, communication skills, and professionalism. When I encounter a challenging colleague, I first try to understand their perspective and the reasons behind their behavior. By putting myself in their shoes, I can better empathize with their situation, which helps to reduce tension. Open and honest communication is crucial. I make an effort to address issues directly but tactfully, discussing any conflicts or misunderstandings in a private, respectful manner. Setting clear boundaries and expectations is also important, as it helps to establish a professional working relationship. Additionally, I remain focused on my work and strive to maintain a positive attitude, ensuring that personal differences do not affect my performance or the overall team dynamics. If the situation does not improve despite these efforts, I would not hesitate to seek guidance from a supervisor or HR to ensure that the workplace remains a supportive and collaborative environment for everyone.
How do you deal with criticism?
Dealing with criticism effectively is essential for personal and professional growth. When I receive criticism, my first step is to listen attentively without interrupting, ensuring I fully understand the feedback being given. I approach criticism with an open mind, viewing it as an opportunity to learn and improve rather than as a personal attack. It's important to consider the source and the intention behind the criticism. Constructive criticism from colleagues or supervisors who have my best interests at heart is especially valuable. I reflect on the feedback, analyzing how it applies to my actions or work and identifying specific areas for improvement. If the criticism is unclear, I seek clarification to better understand what is expected of me. Once I have a clear understanding, I make a plan to address the issues raised and implement changes to enhance my performance. I also appreciate positive reinforcement and constructive feedback, which help me to stay motivated and committed to continuous improvement. By embracing criticism with a positive attitude and a willingness to adapt, I can develop my skills and contribute more effectively to my team and organization.
Tell us about a high-pressure experience you faced and how you handled it.
One high-pressure experience I faced was during my tenure at a busy emergency department when we encountered an unexpected surge of patients following a major accident. The emergency department was already operating at near capacity when news came in about a multi-vehicle accident. We were about to receive a significant influx of patients with severe injuries, stretching our resources thin. As a staff nurse, I had to act quickly and efficiently to manage the situation. I collaborated closely with my colleagues to initiate a triage protocol to prioritize patients based on the severity of their injuries, ensuring those in critical condition received immediate attention. I assisted in setting up additional treatment areas to accommodate the influx and communicated effectively with other nurses and doctors to ensure everyone was aware of their roles and responsibilities. I also provided hands-on care to patients, performing necessary procedures, administering medications, and continuously monitoring their conditions. Throughout this, I maintained a calm and focused demeanor, offering support and reassurance to both patients and my fellow staff members, which helped keep the team motivated and effective under pressure. Despite the high-pressure environment and the sudden influx of patients, we were able to manage the situation effectively. All critical patients received timely care, and the team worked cohesively to address the needs of each individual. Our efficient handling of the situation was later acknowledged by hospital management, and the experience reinforced our protocols for dealing with similar emergencies in the future. This experience highlighted the importance of teamwork, quick decision-making, and effective communication in managing high-pressure situations.
How do you adapt to change?
Adapting to change is a crucial skill in the dynamic field of nursing. I approach change with a positive and open mindset, understanding that it often brings opportunities for improvement and growth. When faced with change, my first step is to gather as much information as possible about the new situation, process, or policy. This helps me understand the rationale behind the change and how it will impact my work and patient care. I then assess how my current skills and knowledge align with the new requirements. If additional training or education is needed, I proactively seek out resources, whether it's through attending workshops, completing online courses, or consulting with more experienced colleagues. I also remain flexible and willing to adjust my routines and methods to align with new protocols. Communication plays a key role in adapting to change. I engage with my team to share insights, discuss challenges, and support each other through the transition. By fostering a collaborative environment, we can collectively find effective ways to implement changes smoothly. Lastly, I maintain a resilient attitude, understanding that some changes may present initial challenges or discomfort. I focus on the long-term benefits and stay patient as I navigate through the adjustment period. This approach not only helps me adapt personally, but also allows me to support my colleagues and contribute to a positive work environment amidst change.
How do you ensure all your patients are cared for?
Ensuring all patients receive optimal care requires a combination of prioritization, organization, and communication. First and foremost, I prioritize patient care based on the severity and urgency of their conditions. This involves performing a thorough assessment and triage to determine who needs immediate attention and who can wait a bit longer. Effective time management is also crucial. I create a detailed plan for each shift, outlining tasks and setting realistic timeframes for each. This plan includes routine check-ins with patients, medication administration, and any other necessary procedures. I make sure to build in time for unexpected situations, as flexibility is key in a healthcare setting. Communication is another critical element. I maintain clear and consistent communication with my colleagues, ensuring everyone is aware of each patient's needs and status. This collaborative approach helps to prevent any gaps in care. Additionally, I make it a point to communicate regularly with my patients, keeping them informed about their treatment plans and addressing any concerns they might have. This not only helps in providing effective care, but also builds trust and rapport. Utilizing available resources efficiently is another strategy one employ. This includes delegating tasks to other team members when appropriate, such as involving nursing assistants for basic care tasks, so I can focus on more complex patient needs. I also make use of technology and electronic health records to keep track of patient information and ensure nothing is overlooked. Finally, I always evaluate and reflect on the care provided, seeking feedback from patients and colleagues and making adjustments as needed. This continuous improvement mindset ensures that I am always striving to provide the best possible care to all my patients.
Which of your professional accomplishments are you most proud of?
One of my professional accomplishments that I am most proud of is leading a quality improvement project in the oncology unit where I work. The project aimed to reduce the incidence of central line-associated bloodstream infections, CLABSIs, which are a significant risk for patients undergoing chemotherapy. Recognizing the importance of this issue, I initiated a comprehensive review of our current practices and identified areas where we could enhance infection control measures. I then formed a multidisciplinary team, including nurses, doctors, and infection control specialists, to develop a targeted action plan. We introduced several key interventions, such as stricter adherence to hand hygiene protocols, standardized central line care procedures, and regular staff training sessions to reinforce best practices. Throughout the project, I closely monitored infection rates and provided ongoing feedback to the team. We also implemented a system for tracking compliance with the new protocols, which helped to ensure consistency in care delivery. The results were remarkable. Within 6 months, we achieved a significant reduction in CLABSIs, which not only improved patient outcomes but also enhanced the overall safety and quality of care in our unit. This accomplishment was recognized by hospital leadership, and our project was presented at a national nursing conference, serving as a model for other healthcare facilities. This experience demonstrated the impact of collaborative efforts and evidence-based practice in driving meaningful improvements in patient care. It also reinforced my commitment to continuous learning and professional development, inspiring me to pursue further initiatives aimed at enhancing healthcare delivery.
How will you maintain a good relationship with a multidisciplinary team?
Maintaining a good relationship with a multidisciplinary team involves effective communication, mutual respect, and collaboration. First and foremost, I prioritize open and clear communication. This means actively listening to team members, sharing information transparently, and ensuring that everyone is on the same page regarding patient care plans and goals. Regular team meetings and briefings are essential for discussing cases, addressing any concerns, and planning coordinated care. Respecting the expertise and contributions of each team member is also crucial. I recognize that each professional brings unique skills and knowledge to the table, whether they are doctors, physical therapists, social workers, or other specialists. Valuing their input and showing appreciation for their efforts fosters a positive and collaborative environment. Collaboration is key to effective teamwork. I make an effort to understand the roles and responsibilities of my colleagues, and I am proactive in seeking their input and support when needed. By working together and leveraging our diverse skills, we can provide comprehensive and holistic care to our patients. Flexibility and adaptability are also important. In a multidisciplinary team, situations can change rapidly, and being able to adapt to new information and adjust plans accordingly helps to maintain smooth operations and high-quality care. Furthermore, I believe in providing constructive feedback and being receptive to it myself. Continuous improvement and learning from one another are integral to maintaining strong professional relationships. By fostering a culture of continuous feedback, we can address issues promptly and enhance our collective performance. Lastly, I strive to build rapport and trust within the team by being reliable, supportive, and approachable. Building strong interpersonal relationships helps to create a cohesive team that works well together, ultimately benefiting our patients and the quality of care we provide.
Importance of teamwork in nursing.
Teamwork in nursing is fundamental to delivering high-quality patient care and ensuring positive health outcomes. The complex nature of healthcare requires the collaboration of professionals with diverse expertise and skills, making teamwork essential in several ways. First, teamwork enhances patient safety. By working together, nurses, doctors, and other healthcare professionals can share vital information, cross-check each other's work, and ensure that all aspects of patient care are covered. This reduces the likelihood of errors and ensures that patient care plans are comprehensive and well-coordinated. Second, effective teamwork improves efficiency. When healthcare teams communicate well and collaborate effectively, tasks are completed more efficiently. This helps to manage the workload more evenly, reduce stress among staff, and ensure that patients receive timely care. Efficient teamwork is particularly important in fast-paced environments like emergency departments, where swift coordination can be critical. Third, teamwork fosters a supportive work environment. In a collaborative team, members can rely on each other for support, share the burden of challenging tasks, and provide assistance when needed. This creates a more positive workplace atmosphere, enhances job satisfaction, and reduces burnout among nursing staff. Moreover, teamwork contributes to professional development. Working closely with colleagues from different disciplines allows nurses to learn new skills, gain insights from others' expertise, and continuously improve their practice. This collective knowledge and skill sharing ultimately enhance the overall quality of care provided to patients. Teamwork also plays a crucial role in patient-centered care. By working together, healthcare professionals can ensure that care is holistic, addressing not only the medical but also the emotional, social, and psychological needs of patients. This multidisciplinary approach ensures that patients receive comprehensive care tailored to their individual needs. In summary, teamwork in nursing is vital for ensuring patient safety, improving efficiency, fostering a supportive work environment, facilitating professional development, and delivering patient-centered care. By working collaboratively, healthcare professionals can achieve better outcomes for their patients and create a more effective and fulfilling work environment.